year from Advanced Rehab and Medical in Jackson, Tennessee. I'm Dr. Megan Von Holtz. I thought I'd go over with you a few New Year's resolution tips for 2018. I know a lot of us, we make health resolutions. We try to drink more water, eat better food, exercise more, and I think that's all great. But I wanted to let you in on something that happens every year. I've been here 11 New Years now, and every year about January 15th we get an influx of patients complaining of shoulder pain, knee pain, plantar fasciitis, foot pain, hip pain, back pain, sciatica, sometimes headaches. And do you know why they all got those pains? You want to guess? It's because they started an exercise program. They thought, you know, I'm so motivated, I'm going to do this, I'm going to do an hour a day, 5 days a week. And after about 2 weeks, their body says, what are you doing? And something breaks. just doesn't do it. Am I saying don't exercise for your New Year's resolution? No. What I'm saying is prevention is the best medicine. So, no matter what reality TV tells you, if you haven't exercised in a year, 3 years, 10 years, it doesn't make sense to exercise for an hour every single day of the week. How about starting small? So you're not giving up on your goal, you're just setting more realistic goals. Maybe say 20 minutes, 3 days a week the first week. If you do great with that, add 5 more minutes, maybe another day. And just gradually increase either number of days or the amount of time each time. If you have pain, then you need to back off, ice that spot for a day or two. If it doesn't get better, you're not 17 anymore probably. You know, when you were 17, you could just push through it and eventually the body would make up the difference. It's not always the best idea to do that if you're not, you know, a professional athlete or someone who's been exercising regularly. You need to listen to your body. It's telling you that for a reason. So ice it, get off of it, elevate it. If that's not helping, you know, maybe you need to pay a visit to me. But usually if you do things slow and steady, and just, for me, the most important thing is developing the habit. You know, we all have bad habits. We have to develop good habits. So if you get that habit of every other day getting in your 20 to 30 minutes of exercise and you get a pattern of that, then it's easier to build from there. But watch, just especially if you do get those pains, especially if they're only on one side, because that could say something about how the posture of the exercise that you're doing or how you're doing it. The other quick thing I will tell you is stretching. I know in the 80s when I was in school, we used to all be in a circle before practice and stretch, and then we'd go do whatever the exercise was for an hour or two. Really, what they say now is you shouldn't stretch first, you need to move first. So maybe walk or a slow run for 5 to 10 minutes, then do your stretching, and then do your exercise. So if you're not used to any exercise, you're probably not going to run for 10 minutes before. Just do some motion type movements for 5 minutes, then do your static stretching, and then do your exercise. These 2 tips, they don't seem great, but they can make a big difference in preventing injuries so that you don't even have to come in to see me. And that really is the best medicine, not getting hurt in the first place. So have a happy, healthy 2018. I'm Dr. Megan Von Holtz for Advanced Rehab and Medical in Jackson, Tennessee.